Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Spinal Epidural Electrode Placement. Introduction. Extreme pain can greatly limit your ability to move and work. Electric stimulation of the spinal cord may help decrease the pain. Doctors may recommend surgery to place a pain control device called an electrode, which provides electric stimulation of the spinal cord in the back of people suffering from extreme pain. If your doctor recommends surgical treatment for your condition, the decision whether or not to have surgery is also yours. This patient education program will help you understand better the benefits and risks of this surgery. Anatomy. The spine protects the spinal cord and nerves that go to different parts of the body. The spine is formed of solid sections of bone called vertebrae. Nerves travel from the brain through the spine to all parts of the body. When the brain orders body parts to move, or if it gives other orders to body parts, these orders are carried through the nerves. These orders travel by electrical impulses in the nerves. Also, feeling and sensation from the body are carried through nerves. Pain is one of the feelings that travel from all parts of the body through the nerves to the brain. Symptoms and their causes. Extreme pain may come from a variety of causes, including blood vessel disease, injury from accidents, disc herniation, and complications from surgery. Nerves carry the pain sensation through the spinal cord to the brain, where the pain is consciously felt. If the nerves in the spinal cord are electrically stimulated, the pain impulses may not be able to reach the brain and cause a feeling of pain. The pain feeling may be replaced by a tingling feeling.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Alternative treatments. This type of pain management is recommended only when the pain is severe and cannot be managed by regular medication. This type of treatment of pain does not help in all cases. Your doctor will carefully examine you to decide if you are a good candidate for this treatment. Surgical treatment. The operation is done under local anesthesia. It may take 1 to 2 hours. The patient is awake and can describe how much pain he or she feels. The patient helps the doctor find the best place to put the electrode to reduce pain. The system consists of 3 parts. 1. The electrode that is placed over the spinal cord. 2. The extension cord. 3. The battery and small computer chip that makes the electric pulse. Depending on what type of electrode is used, it may be placed in the back through a small needle or through an operation that uncovers a small part of the spine. When the electrode is placed, it is connected to the pulse generator. The patient is then asked if the feeling of pain has been replaced by numbness or a tingling sensation. The electrode may need to be moved several times to obtain the best possible placement for reducing the pain. This part of the operation is very important in determining whether this type of treatment will help the patient. After testing, some sedation will be given to make the patient feel better. If more testing is needed, the patient may try the electrode for several days to see if he or she wants it installed permanently. Another incision is then needed to tunnel the connector outside the body. Once the decision is made to keep the electrode in place, the extension cord is tunneled to another location in the back or flank, and the battery is placed under the skin. The whole system is therefore under the skin and does not show from the outside. The patient is given a handheld machine like a remote control, which can increase or decrease the strength of the electrical impulse. With the electrode implanted in the spine, you can use this machine to control pain. Risks and complications. This operation is safe. There are, however, several risks and complications which are unlikely but possible. You need to know about them just in case they happen. By being informed, you may be able to help your doctor detect complications early. The risks and complications include those related to anesthesia and those related to any type of surgery. Risks related to anesthesia include, but are not limited to, heart attacks, strokes, pneumonia, and blood clots in the legs. If the blood clots get dislodged, they may cause respiratory failure. Any of these complications could lead to death. These risks will be discussed with you in greater detail by your anesthesiologist. Some of the risks are seen in any type of surgery. These include 1. Infection in the spine around the nerves or at the skin level. 2. Bleeding. 3. Skin scar that may be painful or ugly. Other risks and complications are related specifically to this surgery. These, again, are very rare. However, it is important to know about them. Spinal fluid may leak from around the nerves and cause a headache. Infections may occur around the nerves and spinal cord. There is a very slight chance of general weakness or even paralysis. There is a slight possibility of bowel or bladder dysfunction. However, this is very rare. Other risks specific to this surgery are related to the use of a mechanical and electronic device. The wires may get disconnected or broken, or the electrode may get displaced. Another operation may be needed to reconnect the parts. Some types of stimulators may require replacement of the battery every 2 to 3 years depending on usage. Like any man-made device, it could malfunction, requiring earlier replacement. This type of treatment is not always successful at controlling the pain. There is a chance that the pain may not be reduced. After the surgery, no repetitive bending or twisting or heavy lifting is allowed in the first few weeks following the operation. After this period of relative rest, physical therapy may be necessary to allow you to resume your previous activities. Whether or not you will be able to resume all previous activities depends on how well you are doing at the time of your follow-up. Your doctor will tell you how long it will take before your back is healed and when you can go back to work. This depends on your age, type of work, and medical condition, as well as other factors.
Check and see if your stimulator is MRI compatible. If not, then inform your healthcare providers so that they do not order an MRI in your case.
Some types of ultrasound treatments for back pain may cause the electrode in the back to heat up, which may cause some nerve damage. You should therefore tell any and all of your healthcare providers about your dorsal column stimulator. When you pass through a metal detector, for example at an airport, you may set off the alarm. It is important to carry your registration card with you to prove you have an implanted medical device.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Spinal electrode placement surgery can help relieve your pain when other non-surgical treatments fail. This operation is very safe with excellent results. However, as you have learned, complications may happen. Knowing about them will help you detect them early if they happen.
Thank you for using Explain.